In Hamilton County, we thrive. We are making it easy for people to eat healthy, be more active, and limit tobacco use. We work together to create lasting changes that keep communities healthy for generations.
We are a much healthier neighborhood than we were 4 years ago because of WeTHRIVE.
In Hamilton County, heart disease, obesity, and diabetes were on the rise. Community and school environments made it difficult to make healthy choices.
We learned about the lack of nutritional awareness and availability in the community. We saw children that were primarily eating chips and drinking soft drinks, watching television, very inactive, and that many of them had little opportunity for safe physical activity.
To create healthier environments, Hamilton County Public Health launched the WeTHRIVE initiative in 2008 through the Strategic Alliance for Health grant from the Centers for Disease Control and Prevention. Laughlin, Lincoln Heights, and Woodlawn were selected for intervention because they were disproportionately affected by heart disease, obesity, and diabetes. The goal is to educate and inspire communities to be their own agents for change. Tobacco-free environments are implemented to protect young lungs at play. Families enjoy parks, community gardens, and other outdoor spaces free of secondhand smoke and tobacco products. With the support of WeTHRIVE, Princeton and Laughlin school districts are tobacco-free campuses, implement competitive food guidelines and physical activity during the regular and extended school day, and harvest vegetable gardens. At Lincoln Heights Elementary School, healthy living is part of the culture. Since all students live within 1 mile, Lincoln Heights Elementary implements a walk-to-school program to encourage students to be active. Neighbors, teachers, and administrators volunteer as crossing guards to ensure students walk safely to school.
When the students are involved in physical activity, they're more energetic in the classroom, they're willing to listen more.
I think there's definitely a positive impact between student physical activity and nutrition and student achievement.
The Princeton and Laughlin school districts encourage physical activity in all aspects of school culture. Teachers incorporate physical activity into their daily lesson plans. The focus of health doesn't stop at being active. Healthy foods are available within the cafeteria, classroom celebrations, vending machines, on-campus fundraisers, and in school gardens.
There were some snack items that didn't fit the criteria. The real impact that we have over the last few years have introduced more whole grains, whole wheat, fresh fruits and vegetables. We get as many as we can.
The school partners with community organizations to build, harvest, and maintain the vegetable garden.
It's raining good.
The students are really welcome and open to working in the garden, and they're excited about it. They're open to trying new foods that maybe they hadn't tried before because they've watched them grow and they've planted them.
You're not ladybugs bite. No, ladybugs don't bite.
It's not only been about health and physical fitness, it's also been about community spirit.
These are 7th and 8th graders, I mind you. Come to the Village of Laughlin Council. They requested a skateboard park to be put in. They got the volunteers to come and build it. Before we had trouble with vandalism and things, and now these same kids, they take care of the park, so they feel a part of the ownership of the parks.
Physical activity projects are driven by youth and community members. Each village established partnerships with community organizations and local businesses to leverage funding and resources, provide support and volunteer time, and to build or repair spaces for families to be active.
We've been able to institute a physical fitness at one of our recreation centers. We see more people walking, and we have a new playground that allows the children to play safer. So it's made a very, very big impact.
The Healthy Corner Store initiative is implemented to increase access to fresh produce within the community.
Before we had candy that was sitting right off to the right on the shelving area, so we moved that into a remote location. And now what you see when you come in are bins of fruits and vegetables, as well as the art displays from the children from the community. And working with WeTHRIVE, it keeps us in a positive mind frame of going forward and being able to offer the community not just things that are handy and available to eat, but things that will be healthy and good for them.
But these will grow until, oh my gosh, these will grow until winter.
To further increase access to fresh produce, community gardens were harvested. Produce was donated to churches, child care centers, food pantries, and residents in need.
Just because somebody planted it doesn't mean it's not for you. When you think about it, that's really how a community thrives, is what they can do together and with trust is built.
Who wants more cucumbers?
Me!
Habits develop early in life. Child care centers help children start off on the right foot by teaching healthy habits and providing healthy meals, daily physical activity, and a tobacco-free environment.
Can I eat it now?
Go eat it when you get inside.
Churches are often the cornerstone of the community. WeTHRIVE engages churches to encourage healthy eating, physical activity, and tobacco-free behaviors among community and congressional members of all ages.
We learned about the great hunger in the community, and we learned about the needs of the children. And we began to realize that these children needed help and they needed hope. Because of WeTHRIVE and what we've learned, we've been able to change a lot of lives in the community through these children.
Lockland, Lincoln Heights, and Woodlawn unite to create a healthier environment where residents of all ages can thrive where they live, work, learn, worship, and play.
Healthier students make healthier learners.
Lockland is more health conscious than what they was before WeTHRIVE come.
We now have the resources to be able to help our community to become healthier.
It's given us opportunity to see what else we can do on our own. And the fact that we were able to come together and do some things and have some commonalities, we've shared stories, we've shared resources. You know, it's all about how we can be diverse but yet have a commonality, and that's what WeTHRIVE has done.
1, 2, 3.
This is why we're here. This is what we do. Join the movement.